How the U.S. health system works. Background. Medical care was hard to get in the early years because only a few British-trained physicians came to North America. However, New Orleans, Philadelphia, and New York had founded the first major hospitals along with the first medical schools by the mid-18th century. But the Royal Hospital in New Orleans, which was the first hospital, was too expensive for many residents. That led to the building of a second hospital, the Charity Hospital, that would aid the people on a charitable basis. Throughout U.S. history and still today, many hospitals have run by religious organizations throughout the U.S., tending to the illnesses of the poor. Many hospitals were built during the U.S. Civil War. The federal government and individual states began to build hospitals in each state to tend to the sick and wounded soldiers. Public health provisions such as clean water, sanitation services, and tuberculosis control was also initiated during this time by the government. In 1965, the Medicare and Medicaid systems, which ensure senior citizens and people whose earnings fall under the poverty line, were enacted by President Lyndon Johnson. This created a large federal healthcare system that covers millions of Americans. U.S. health insurance system. Patients pay monthly health insurance fees to ensure that they will be covered in case of medical care. Insurance providers cover thousands of patients. The Medicare or Medicaid insurance works the same way but on a bigger scale. Insurance providers generally have a network of doctors that they have agreements with, since they need to be able to negotiate. Patients are covered for visits to doctors within that network. Insurance providers will usually cover services considered necessary by doctors, but often will not cover services that are considered elective. Insurance companies aim to keep their costs down while still covering necessary health care. Patient Protection and Affordable Care Act. The Obama administration attempted to address some of the issues with the Patient Protection and Affordable Care Act. Some major provisions of the law. Insurers are not allowed to refuse coverage because of pre-existing conditions. Minimum standards for health insurance policies were established. Medicaid eligibility expanded. Medicare underwent reforms aimed at greater efficiency. Individuals without employer-provided insurance are required to purchase health insurance. Health exchanges were set up to offer consumers a good way to find suitable health insurance and to provide subsidies for those who need it.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.